You can start the stage 2 exercises when you feel ready to move on to the next stage, and only when your wound is healing well. If you have removable stitches or a drain, then wait until after they've been removed. If you're unsure about when to start, or if you have problems with fluid collecting in your affected arm, a wound infection or pain, then speak to your breast care nurse or doctor and ask for advice. Continue with these exercises until full arm mobility is achieved. Start with a warm-up and take a comfortable position. Either stand with your feet hip-width apart and a straight back, or sit on a chair with a straight back. Do 5 shoulder rolls. Start with your arms at your sides, slightly away from your body, with your palms facing your body. Slowly lift your shoulders up towards your ears as far as possible. Roll them backwards and down to your starting position. Do this 5 times. Lift your shoulders right up, roll them backwards slowly and down. And again, up, backwards and down. You're trying to warm up the muscles in your shoulders. Up, backwards and down for 4. And the last one, shoulders up to your ears, backwards and down. The first few of the middle stage post-op exercises are done on the floor, or if it's more comfortable for you, do them on a bed. In all the exercises, you should be trying to raise your arms above shoulder level, and you'll do some gentle stretches. Do these exercises 3 times a day and repeat them at least 5 times before you move on to the next one. So, for the first exercise, the elbow drop, lie flat on the floor on a mat or on a bed with your knees bent if possible and your feet flat on the floor. Place your hands behind your neck with your elbows pointing to the ceiling. Keep your head up and drop your elbows slowly to the sides as far as you can go. Hold this stretch for 10 seconds. Then bring your elbows back to the middle and repeat this. Drop your elbows slowly. Hold the stretch for 10 seconds. Bring your elbows back to the middle. That was 2. And again, drop them. Hold them for 10 seconds. And go back to your starting point. It's important to try and hold the stretch to maximize your range of movement. And now for the last one, hold the stretch at least 10 seconds, then go back to the middle. The next exercise, the snow angel, is also done on a mat, on the floor or on a bed. Lie down on your back with your knees bent and your feet flat on the floor. Start by placing your arms relaxed by your sides with the palms of your hands facing your body. Keep your shoulders down and away from your ears. Now bring your arms away from your body and slowly rotate your palms so they're facing up. Gently continue to slide your arms along the floor to an overhead position or as high as you can go. Hold this gentle stretch for 10 seconds. Then bring your arms slowly back to where you started. Do this exercise 5 times. So, slide your arms along the floor and up. Don't raise them higher than you can and feel comfortable with. Hold for 10 seconds. And then gently go down again. Again, arms up. Hold it there. Keeping your shoulders down and away from your ears. Hold for 10 seconds. And then down again. That was the third one. And 4 times, gently up. Hold for 10 seconds. Gently down again. And now the last one, rotating your hands so that the palms are facing the ceiling, bringing your arms up as high as you're comfortable with. Keep your shoulders down, hold the stretch for 10 seconds. And then gently back down again. And that's your 5 exercises. The rest of the exercises are done standing or while sitting. Be as upright as possible. We start with the arm raise. Hold the wrist of the affected arm with the other arm. Gently raise both arms upwards and away from your body while you support the affected arm. Remember to keep your shoulders down, away from your ears. Slowly lift the arms above shoulder height towards the ceiling as far as possible. Hold there for 10 seconds. And then return your arms to your waist. And you're going to repeat this 5 times. That was the first. So, for the second time, raise both arms up and support your affected arm. Go all the way up above your shoulder if you can, but make sure that your shoulders are down and away from your ears. Hold the stretch for 10 seconds. And then down again. That was the second. And for the third time, raise your arms up and above your shoulder. If you can't raise your arms that far, then bring them to the most comfortable position. Remember, it'll take time to get back your full range of movement, and you won't be able to do this immediately. Then slowly bring the arm down. And that was number 3. So for number 4, supporting that arm, take it as far as you can. As you do these exercises, you'll be able to get further. Hold it for 10 seconds. And then gently back down again. And for the last time, support that arm all the way up. Take it as far as you can. Hold it up there for 10 seconds. And then back down to your waist again. And that was the last one. The next exercise is called the towel stretch, and you're going to need a rolled up towel for the exercise. Stand or sit on a chair with your back straight. Hold the rolled up towel behind your back with your unaffected arm, this one, at the top, and the affected arm at the bottom of the towel. Now use your unaffected arm and pull the other arm up your back as far as possible. You should feel a light stretch. Hold this for about 10 seconds or as long as you can, and then go back. And repeat this slowly. Go up. Hold the stretch and back down again. We're doing this one 5 times, but try to avoid any movement that gives you sharp pain or pinching in the shoulders while you're doing this. That was 3, 2 more to go. Pulling your affected arm up, hold it there and slowly let go. And then the last one, pull up, hold the stretch, and then go back to where you started. Let's finish off with a quick cool down and a few shoulder rolls. Slowly raise your shoulders up to your ears as far as possible, then roll your shoulders slowly backwards and down to your starting position. Shoulders up, roll backwards and down, and you're going to repeat this 5 times, so that's 2, up, backwards and down for 3, up, backwards and down for 4, and the last one, up, backwards and down.